Hello and good afternoon, everyone. My name is Mimi Roche, and I will be your training and implementation specialist or subject matter expert when it comes to getting started with ISP programs. We'll begin in a couple of seconds, just allowing others to enter into the webinar. So just a couple of more seconds. Thank you so much for joining us. Looks like we have a few more people who are joining us. Thank you so much for spending the afternoon with us at Therap. We are currently just allowing a couple of seconds to get enough people into the room and begin our session. So good afternoon. We're going to go ahead and get started with ISP Programs. My name is Mimi Roche, and I'm one of Therap's Senior Training and Implementation Specialists. Along with me, I also have my colleague, Connie O'Neill, who's also a Training and Implementation Specialist. And today we will be talking a little bit about getting started with ISP Programs and what that configuration looks like in your Therap system. Just a disclaimer, know that any information support services is just for informational purposes only during this webinar. And here goes our retention of rights, which basically protects our intellectual properties. I'm going to go ahead and hop in quickly into a demo account. Know that all the individuals in this account are all fictitious. The information is just being used for informational purposes only. Please know that if you have any questions, you can use the Q&A icon to post your questions, as well as we will comment. Connie will go ahead and answer any of those questions that you may have. Feel free to also chat at the bottom using the bottom icon that says chat in your Zoom control panel. And again, this is basically just getting started with ISP programs, talking a little bit about where you could find some of those templates, some of those permissions that you need to get started with ISP programs, where you would locate those, acknowledge them, as well as document. And maybe we'll have enough time to look at maybe some reporting. Okay. Again, if you have any questions, use the Q&A at the bottom of your screen in your Zoom control panel. So I am in a demo account. I'm going to go ahead and first get started from my admin tab. And I'll show you some of the resources that we do have on the actual Therap Help and Support website, which will guide you on step-by-step instructions on creating an ISP program, as well as we do have some self-directed courses that you can take just to kind of test your own knowledge if you are ready to hop into your live account and create some of those. What I would like to do is I would like to post a question, or let me go ahead and maybe try these polls. I wanted to launch a poll. Connie, can you see the poll on my screen?
Yes, I can.
Great. It looks like most of you are already responding. Fantastic. And it's basically, are you currently using ISP programs? You know, is that a yes? Is that a no? Or are you just simply here because you're thinking about it? Maybe you want to take those T-logs that you're currently using as your documentation and maybe turn that documentation into true person-centered, data-driven reports. Okay. Hopefully we'll have some time at the end of this webinar to maybe talk a little bit further about being more person-centered in ISP programs. Okay. Fantastic. Thank you all for responding on the poll. Let me see here. I'll go ahead and show you the results so far. So it looks like 11 out of 14, and 3 of you are thinking about it. Okay. So from my admin tab, hopping into your admin roles, user privileges, I'm going to click on manage just because I want to talk a little bit about some of those permissions in your admin role that would allow you certain access to items for ISP programs. Okay. So one of the things you really want to think about is that scoring method in that administrative roles section. That scoring method permission is going to allow you to create a master scoring list. You're probably saying, Mimi, what's a master scoring list? It's that drop down that allows staff to choose things like services provided, services not provided. Maybe it's a yes or a no. Maybe it's one of those level of independence, right? Independent, verbal prompts, verbal cues, partial prompts, maybe a refusal or a decline. Maybe you're looking to customize that, where you're looking to see, how many verbal prompts or verbal cues did it take someone to actually achieve a goal? So you can use numbers as well. You can create your master scoring method here using this permission, and I'll show you where you can create that from your dashboard. So that's going to be the scoring method that allows you to create your own customizable one, so that you don't have to define a new scoring method per ISP program. You can choose that from the master list. Over here within that module role section, if I scroll further down, you'll see that I have what's called the ISP program template submit and approve one. Okay. It also gives you ISP program template to view. This is going to allow you to see some of those templates that are created. Okay. If you're looking to use any global template ISP programs from our larger library, you can import those as well as edit those to be more specific to your organization's needs, and then approve them and link them to the individuals that you serve. So again, you have some of these permissions. Feel free to also look up list of roles from our help and support site, because the list of roles actually guides you as to what each permission allows that user to do. And always remember to go ahead and save. Okay. From your super role section, hopping into that super role, you want to make sure that for your ISP programs, you are giving your staff the privileges that they need in order to do things like document. So if staff needs to go in and do some of that documentation on daily goals, weekly goals, monthly goals, you want to make sure that you're coming into that ISP data submit. And if you also want them to view, you would give them ISP data view. ISP data update allows them to go in and do some updating to the data that has been collected. However, it allows them to update others' documentation. ISP data submit allows them to submit data as well as update only the ones that they've created. Okay. So you want to make sure that you're giving them access to things like ISP data for ISP data collection. ISP program, you also want to, depending on their responsibilities at your organization, submit allows them to create an ISP program. Okay, submit it so that maybe someone else who has the approval key would be the ones who overlook that ISP program that was created and then approve it so that it turns into an ISP data allowing staff to do their documentation. Okay. You also have access, if you're doing data-driven outcomes, we would definitely connect you with our data-driven outcome specialist, who would then walk you through the ISP program mapping piece. ISP reports allows them to actually see those reports. So if they're, ISP reports allows them to review reports, run reports and view them, as well as ISP report allows them to just see the ones that you have created in your account, allowing those to see. Okay. When it comes to ISP, jumping back to ISP program, giving your DSP's ISP program view allows them to view that approved ISP program, read over those qualifications or those requirements, and acknowledging the ISP program so that you can capture that stamp of their date, name, and time that they acknowledge they will document on behalf of the goals for the individual. So a couple of things that you want to keep in mind. Okay. So for that master scoring method from your admin tab, you will see that you have what's called ISP program scoring method. And this is where you can define your own organization's master scoring method. You would give it a title, a name. You would say, I want this scoring method to have maybe 10 different options of answers. So you can have things like, maybe independent, you have your verbal prompts. Okay. Things like, let's see here, maybe hand over hand assistance. Okay, it's going to require you to go ahead and put in an acronym. And the reason for that is so that when you are running those reports, you know what each of those pieces mean. HOH means hand over hand assistance. Remember that to also include things like maybe a non-applicable one for those goals that maybe are only worked on specific shifts. Okay. So maybe it's a toothbrushing program and it's connected under one ISP program. However, morning's going to be documenting on that. Second shift may not. If I'm not working on that goal, I can choose that non-applicable one. But whenever you add a non-applicable to your scoring method, you want to make sure to make that one a non-reportable score. You don't want to see the non-applicable, the non-reportable on your reports. And then you would just save. Okay, I see a question came in. What is ISP mapping? And that's geared towards your data-driven outcomes. That's when you're becoming more person-centered as far as documentation on goals. Okay, you get to run reports that shows you things like, for every time that a specific staff is on shift, why is it that this individual is refusing to accomplish a goal? Could it be that maybe the two don't link, right? So maybe we need to change out staff and put a new staff in place to see if there's a change with meeting those goals. Okay. So I'm going to go ahead and hop right into my individual tab. Oops, sorry. From my individual tab, a couple of things I want you to know. You have access to what's called the Global Template Library. Think of this as the public library where you would go and borrow books in the good old days. So you would go into that Global Template Library. You would click on Search ISP Template. If there's something specific that you're looking for, you can certainly use the template names or keywords. I like to just recommend that you just leave everything blank here and go ahead and click Search. When you are clicking Search, bear with me one moment, please. When you are clicking Search, it's going to open up the entire library, allowing you to see other ISP templates that have been created by other providers. Okay, going back to working smarter, not harder, right? If there's a template that's close to what we are currently documenting at our organization, why not take that template that has been already created, make a couple of minor tweaks or edits to that, import that into your own account, and then link it to your individuals. So let's see here. If, let's say at our organization, we're looking at things like maybe, what is SL daily activities? I'm going to click on that. And this template was created by a provider. And what they did was they filled it out to kind of guide you on what information should go in certain places. So what would be that long-term objective? Participant will engage in activities that encourage independence. And then a little bit of that goal and service. What's the reason for the ISP program? Okay. All of this information is configurable once you've imported that into your own agency account. Okay. You have things like a location, your maximum number of times a day for documentation, your frequency, your schedules. What's the criteria for the completion, materials required? They've also included a scoring detail. So this one here has a scoring method of just about maybe 12, I would like to say here. And again, this piece is customizable once you import that into your account. So if you're not using things like an awake or sleeping, you can remove that from the scoring method or use your own that you've created ahead of time. Moving further down to where you see the tasks. Now, these are the items or the goals, strategies, or outcomes that is coming with this template. Things like shopping, menu plan, leisure and recreation. You've got grooming and housekeeping. They've also included things like breakfast, lunch, and dinner. So it looks like under this ISP program template, they've included all of the goals. Do you have to use all of these goals that comes with the template? Absolutely not. You can remove, and you can also add things that are more specific to your organization. Okay. You have a section where you could add things like a teaching method, some of that guidance for staff on how they need to support that individual, either per goal or just an overall introduction of a guidance. All right. Connie, are there any questions? I'll pause right there.
None yet. They were just wondering, I did have one that might be good for everybody. One individual wanted to know if you can search directly for like templates for like North Carolina. And my suggestion was to put North Carolina in the keyword search. That will bring up some that were designed just for North Carolina. I do that a lot with some of my states.
Let's see if we have anything. North Rocky Mountains.
Northern Rocky Mountains, yeah, maybe NC.
Is there something specific? Put that in the chat, and then we'll take a little bit of time later on to search a little bit further, maybe help you to find something that's more for your state, okay? So I'm going to go back into that SL daily activities. And within that teaching method, again, is that guidance, okay? You have your other details section. Now, this is really important. You want to pay attention to the other details section when you are importing a template. It is customizable, but certain things to pay attention would be to that time duration format. Are you looking to capture a begin time and end time of service, right? If you're doing a services provided, services not provided, are you looking for that 8 to 4, 7 to 3 time frame? Are you looking for this to just simply be a duration in minutes, 20 minutes, 30 minutes, 15 minutes, okay? Also paying attention, will the begin time and end time be required for data collection? Now, if you're using that time duration format to maybe capture a report and use that for your payroll system, maybe you do want to make that section to be required. This way you're capturing that begin time and end time, you can run those reports, pull that data, put that into your ADP system. You have another section that's called Are Other Comments Required for Data Collection, as well as the task scoring comments. So you have two comment sections that's included within the ISP program. And I'll show you that in a bit when I hop into a true one. Task scoring comments is after they've selected a score, independent, yes, no, refusal. A box will appear further down below, right below that scoring method answer, allowing for that staff to maybe put in some detailed information per goal. But then you also have a larger box at the bottom of the data collection page that allows them to do kind of like a summary or service note of all. Okay. You have your location for data collection. You know, if my ISP program includes things like outings, maybe I want to make that required so that whenever they document on that outing, I know that they took Penelope bowling or horseback riding, or she went swimming, right? Where did she spend that community outing? I remember back in my agency days, that was always a requirement when it came to either community interaction or community outing goals, okay? So paying attention again, task scoring comments, your default score, all of this is customizable. We'll hop into that in a minute. Let me show you what you would do when you've located that ISP template that you're thinking, this is the one that we're going to use. You would just scroll down to the bottom, okay? And you would want to import this as a draft. Once you click on import this as a draft, I'm not going to import it because it's actually telling me this format's been imported 2 times. Are you sure you want to do it again? And I don't. But I'll just go ahead and click OK just to show you what that next page is going to look like. This is where you would then sign off to the agreements of using that template. You would click on I have agreed, and then you would just simply click continue. okay? Once you've done that, it will be located, bear with me one moment. Once you've done that, it's going to go from this section. Remember, when we're here visiting the Global Template Library, it's going to hop right into your above ISP Program Template Library. This is your agency library. This is the global one. So the public one, and then when you import it, it hops right into that draft because you imported it as a draft. You would go into that draft section, and then you would just simply go in and you would locate that ISP template. And let's see here, I'm just going to take a template from someone else. If I go ahead and click on this toothbrushing one, this was one that was imported from the Global Template Library. Notice how now these boxes have opened up and said, guess what, Mimi, you can make changes now. You can rename that template if you'd like. You can go ahead and maybe change some of that information that's under the long-term objective, making it more specific to your agency, but not specific to the individual yet, okay? It's just your master original, if you will. You have your goal and service section where you can make this, again, more specific to your agency. You have your maximum number of times a day, your frequency, your schedules. You can say things like, you can modify that from the master original, but then you also get to edit it once you've linked it to an individual. So if this is something that needs to be done maybe, 3 times a day because we're doing morning, noon, and evening oral care, oral hygiene, then I want that frequency to be 3 times daily, right? And then maybe I want to go ahead and specify that in this section, saying things like, let's see here. This should be, every day, 3 times a day, and even going further as morning, or maybe before breakfast, maybe it's after lunch and after dinner, right? So you can be more specific in your template now that it's been imported into your account. You can change some of the information as far as the criteria and as well as the materials required here. Here goes that scoring details section, your scoring methods. This one came with declined, partial, partially complete, or complete, and some teaching methods. Now, if I wanted to go ahead and change that scoring method, I would scroll all the way down to the bottom left, find that change scoring method, and now I can go ahead and say, let me see what this level of independence has to offer. This one is telling me if this person needed, did they complete that goal independently with the verbal cue demonstration, partial, full physical, or decline. You also have where there's one that's just a yes or no, okay? If there was one that I created from my master scoring list, it will appear here so that I can choose from that list. Okay, and maybe this is the one that I want to go for because I'm looking for full physical, I'm looking for the 2 verbal prompts, I'm looking for also, 1 gestural visual aid prompts. I'm looking for all of this to be the variety of answers that my staff could choose from whenever they're documenting on a goal. Okay, and if I click continue, I'm going to say, okay, now I have included this one to be my scoring method for that toothbrushing goal. Notice how I have teaching methods, but I don't have any tasks, any outcomes or strategies. I can come right back down to the bottom left, right next to change the scoring method and add a task. And this is where I could say maybe outcome 1. And this would be maybe what level of was needed for maybe applying toothpaste to the toothbrush, right? Because I'm looking to capture that detailed information. Maybe if refused, please add comments. And then I can add another, and maybe my outcome 2 would be what level of assistance was needed to turn on the water. Okay, if refused, please add comments. Right, and the list goes on and on, so I can continue to add more. And now you see that I have my drop down so staff could choose an answer. And then I also have my outcomes, my goals, my tasks or strategies, okay? You see that I have my teaching methods that I could also modify to be more detailed by coming down at the bottom right and clicking on editing the teaching method or adding a new teaching method. There goes the other details, as I mentioned before. Type of service provided could be your organization or maybe my direct support professionals, because they're the ones who are going to be going in and documenting on these goals. I'm going to pause before I hop into the other details. Connie, any questions?
I know we're good so far, Mimi. Thank you.
Great. Okay. So entered by, this is from the template, ISP program author. I could change that to be maybe my name. I'm the one that's actually, creating this. Let's see here. Where am I? Can't find myself. I'll just put in Karen for now. If this is an EVV supporting documentation for billing, for those who are doing EVV currently in your state, EVV stands for electronic visit verification. So if this is going to be that supporting documentation that you need to prove to the state, staff checked in, checked out, and these are the items that they assisted the individual with, then you would want to maybe change that to be a yes for that EVV supporting doc. If you're not too sure, meet with your training and implementation specialist and let them guide you in the right direction. Okay, again, this is a generic one. It's not linked to an individual. You will have the option to make that an EVV doc when you link it to an individual. Time duration format. This is where the begin time and end time, as I mentioned before. Are you looking to capture the 8 to 4s, the 7 to 3s, or are you looking to just capture the 15 minutes, the 20 minutes, 30 minutes? Or maybe you're not even looking for that time frame. You would then make your selection and choose none. I'm going to leave it with begin time and end time because I want to know how long this took. Or I can put duration in minutes. Do I want that begin time and end time to be required for data collection? Yes, I do, if there's at least one reportable score, okay? Are the comments required for data collection? That's gonna be the larger box at the bottom after billable that would force staff to either put in some sort of a summary or a service note. Maybe I'll say yes if there's at least one reportable score. Because if most of the stuff was not applicable, but one score was reportable, it's gonna turn red for staff. Will that location for data collection be required? Well, this is toothbrushing. Do I really, we would all hope that toothbrushing is taking place in the bathroom, okay? Sometimes you do have that one individual who's very unique and it's like, nope, today I'm gonna do the goal, but I'm gonna brush my teeth in the kitchen area, right? And maybe that's the data that you're looking to capture because maybe that future goal is to get them from no longer wanting to do that in the kitchen and doing it in the proper place where it should be in the bathroom. So maybe that's data that you want to collect. You can make it required, optional, required if there's at least one reportable score. Task scoring comments. This is where if staff says this task was completed independently, right below there will be a comment box that they can put in a quick short sentence. Or if they refuse, they can say why, okay? I'm gonna say optional, I'm not gonna make it required. Well, maybe I'll make it required if there's at least one reportable score. Default score. I have so many to choose from, but do I truly wanna pre-populate a score? Because then that means that I've already answered it for my staff and they might not change it to a true scoring answer. So maybe I want to leave it as select score. Again, you know your staff better than anyone. You'll know what you want to populate. If it's an ISP program that has a list of goals, maybe 20 of those, maybe you might pre-populate a not applicable one because you don't want them to spend too many times changing each one if all they're answering is 2 out of the 20, okay? Edible service provider for data collection. This will allow for staff to say, I'm the one who's documenting, but Connie was the one who physically provided the service to that individual. You can choose to say yes. However, at your organization, if everyone's responsible for their own documentation, then you would probably want to say no. If this is going to be used as a billable piece of supporting documentation for billing, go ahead and make that a default yes. Okay, this way it starts to capture that data at the beginning. And if you are using Therap for billing, you'll be able to pull out that ISP data information and bill off of that. Are you allowing collection of multiple task force for a single day? Okay, if you got that AM, noon, and PM, then maybe yes, I'm allowing for collection of multiple task force for a day. Okay, allow data collection with time overlap depending on where you are. Okay, if you have the 2-to-1 staff, then maybe you are going to allow it. If you're not, then you would probably say no. And going back to that ISP mapping, if you are participating in the data-driven outcome, which is called DDO, being more person-centered, then you would probably want to turn this on yes. But again, I urge you, reach out to your training and implementation specialist for further additional guidance when you are implementing your DDO module in your Therap account. You have a section where you could upload files if necessary. Because this is a generic kind of template, it's not linked to anyone specific, I would leave this blank. But maybe once I link it to an individual, that's where I want to put in that goals section of their ISP. Maybe I want to just add that or scan that in to have that as my proof of we followed the plan to the T. What was on paper is now created electronically, okay? Once you've made all of your changes, your modifications to make it more agency specific, you can then go ahead and approve this, okay? Now that it has been approved, it's going to go from, so we started global template library, we found a template, we imported it as a draft, we found it in the draft, we've approved it, and now it moves over to your published section. Okay, I'm going to go ahead and type in, because it was called toothbrushing. And I can go ahead and take a look at the toothbrushing goal. Maybe this wasn't the one that I wanted. Let's go back one. What's it, toothbrushing? Here we go. This is the one that nope, I didn't say that one. Maybe there's too many toothbrushing goals within this one. I can't recall which is the one that I had. Was it this one here? And if not, we can still work off of this one, okay? So now that you can see, here goes a template. It's been approved. From the published section, I can apply this now to an individual. So I would then say, I want to apply this to someone in the G's residential agency. I'm going to apply that to Penelope. And now that ISP program name, I can certainly go into the beginning and say, maybe this is, Penelope's toothbrushing goal, okay? The start date should be the date that you are allowing for this to begin and data to be collected. So if I'm starting this, let's say today's date, anything prior to today's date, this would not be available for staff to do their documentation. One of the really cool things about the new update that we've done to this is that if you look over to your right in that question mark, you will see that within that question mark, we've provided some guidance. So as far as what is an ISP program mean, this is the title of the ISP program, what the start date should be, what the end date, what does that mean? Okay, this is the last date of when data is allowed to be collected. So it doesn't expire this or discontinues it. The end date just simply shuts it down so that staff cannot document past that date. You can certainly always go back in if necessary and change that date to allow any other collection of data that was missed. But the end date basically just shuts it down. Okay. Target completion date, anticipated date of completion. So this field does not impact the data collection. Adding a target completion date will not also discontinue the ISP program. Okay, it's just about the data. You have the location, long-term objective. So we provide a little bit of guidance for those who are fairly new to maybe ISP programs on what information should go in each section. Okay. And again, things like reason, let's change Jenny's because this is not Jenny's. This belongs now to Penelope. Okay. Again, making it more specific to the individual that you're linking it to. So this is an ongoing. We have some materials required. Once you've linked that ISP program to an individual, you can make your modifications if necessary. So I can go here and say, you know, let's see here. This one's going to be tracked 3 times a day. Maximum number of times a day. Again, coming back over to that question mark, it's going to explain to you that this means how many times documentation can occur in a single 24-hour period. Okay. Things like the level of independence. So if you're looking to capture a different scoring method, you can change the scoring method here. So if we don't want, you know, decline for physical, you could make changes here. The default score, again, if I'm looking to pre-populate a default score, or maybe just leave it as please select. Task scoring comments, I can go ahead and say, I want this to be required for all scores, maybe required for a reportable score, or maybe just simply optional. Okay. You can add baseline dates if you already have that data. If not, you can certainly leave baseline dates blank and run your reports, run your quarterly report to capture those baseline scores and use it as your future info moving forward for the new plan. For the tasks, again, as I changed because I didn't locate that toothbrushing one, this one here, I can go ahead and edit this, or I can add some additional tasks. So maybe here we go. I'm going to say, and the only reason why I'm doing this is because the other toothbrushing one, I'm not sure if did I approve it or not. Okay. And then I could say, if defined, please comment. And I can click continue. And then you'll see that I can build my more specific ones to that individual, to Penelope. I could also edit anything that came over from the template. Here goes some teaching methods. You can also edit some of those teaching methods if necessary, or add some additional ones. If this is an EVV supporting documentation, again, you can change that to a yes. If not, you would leave it as a no. If this is a billable ISP program, I can go ahead and say default yes. And again, your DDOs, reach out to your training implementation specialist for guidance here. For the other details section, I know I spoke a little bit about that, but again, refer back to those quick, helpful question icon boxes. This is going to guide you to what to put in each section. So if I click on the user guide, it's going to open up another tab for me. And what's nice about this is that if I go ahead and scroll down, See how it's basically explaining everything about those little pieces. But right down here, sorry if I'm confusing anyone, but where's my little cheat sheet? Ah, not that section. Here we go. This piece right here, it's going to give you some of those ideas as to what you should be putting into those sections in here. Okay, so visit those question marks and get that additional guidance.
Mimi,
Yes.
we have a question.
Sure.
To know the baseline dates are to track data from when the program started to assess the efficacy of the ISP program for the client over time. Is that correct?
Correct.
Thank you.
Sure. So from your other details section, again, making those modifications for that time duration format, what are you looking to capture? Will the begin time and end time be required? Time overlapping, again, making those configurable decisions here so that when staff goes into document, they're following this as you've configured it. Okay. This is where you can upload that plan or that program that you have, that paper document. You can store it right here. So this way, if you're looking to do away with paper, this is your best way to go about it. Just upload it right here and have it handy at any given time, especially when you have, whether it's inspections or licensing and they want to see that paper doc, you would already have that linked here, making sure that it's linked to the correct individual that you are attaching, creating that ISP program for. Okay. Once you are good to go, or if you're not good to go, you can save this and still come back to it and work on it a little bit more. But if you feel to yourself, you know what, I think this is good. However, I want maybe Connie, I want someone else to set another set of eyes to take a look at this and just ensure me that everything looks good to go, then I would submit this so that that person who has that approval role can double check it and then approve it. But if I'm confident and I do have access to approve this in my privileges, then I can go ahead and just simply approve this. It's going to give me an alert letting me know once this has been approved, certain items cannot be changed. If you are comfortable with that, then you would just go ahead and say yes. And now it has been successfully approved and linked to that individual. So now the next question is, Mimi, what happens once you approve it? Where does it go? Going back to my dashboard, if I click on my to-do tab, you'll see that right here, it'll say ISP data. So whenever an ISP program has been approved, it turns into an ISP data collection page for your staff. Okay. It'll also be on your admin's account. So for those who are admins of the Therap accounts, you would have to go to your to-do tab in order to locate this. You could also go into your individual tab, and if you're attempting to document for the first time, on that goal for Penelope, right, choosing the program and the place, you'll see that it's going to let me know that this has not been acknowledged. So I would have to actually go in, read over that plan, okay, and get to see everything that was added onto that ISP program, what the tasks are, if there's any guidance, okay, other details. Scroll down, and this is where your staff would acknowledge. You would only need to acknowledge this once a year or up until there is some sort of a revision. You can also, if you have any questions about this ISP program, you can SCOM this to an admin if you're a DSP and say, hey, listen, I know that we were working on this goal for Penelope, but there's something that seems to be a little bit off. I thought something had changed from her last meeting. So certainly use that SCOM to communicate. Staff would then go ahead and acknowledge and then sign off yes on the attestation that you acknowledge, you have read and understand that you will accurately implement this program. And now it says, now that you've stamped your name, date, and title on this, we've opened it up so that you can start data collection, okay? So remember, I did the start date to be 9/15, so I won't be able to go back to 9/14 or 9/13. I wouldn't recommend putting in historical data. Choose the date that you're gonna go live with this ISP program and move forward, okay? You have access through this link to view that ISP program that I just acknowledged and signed off on. It's gonna give me a little bit of information about the start date, the frequency, the schedule, and staff would just simply click on next. And this is what that ISP data page is going to look like, okay? So staff would go in and say, maybe this was a morning ago, I assisted her from 6 to maybe it was 6:30. We worked on toothbrushing, okay? Let's see here, and I'll say AM and AM, and maybe this was, you know, at the house, if I need to be more descriptive, okay? This is where that editable service provider, so entered by is by me, but let's say someone, another staff member, I'm the one who's doing the documentation in Therap, but someone else physically assisted Penelope with her toothbrushing goal, I can change it to reflect that it was, I don't know, I'll just choose, let's see here, we'll say Devin, okay? Task scores. So here goes the description. Get items for toothbrushing. How was that completed? Was it done full physical, decline, partial physical? Okay. Maybe it was with a simple verbal cue. This is that task scoring box that I mentioned, where they can put a short sentence of how the goal was achieved. Okay. We know that it was a verbal cue, but maybe it took with 2 verbal cues. You can certainly make your scores here to include a two verbal cues, 3 verbal prompts in your scoring method. Remember that. What level of assistance was needed for toothbrushing? So right here, I could say maybe this is where they declined. And now the guidance is, if declined, please comment. So I'm going to say, maybe she didn't like the taste of the toothpaste, right? So maybe this is one of those where you would have staff write a T-log to say, you know, she refused, she didn't like her toothpaste, and maybe someone can go out, take her shopping to purchase a toothpaste that maybe she would probably like even better, okay? Further down, it's billable because we made it as a default yes. And then in the comments section is putting a full on service note or summary, okay? You can make this box require for a reportable score or just optional, as well as this comment box here. And then staff would just simply come down to the bottom right and click submit. So it's all about how you build that ISP program so that staff could do their documenting. One of the other cool things I wanted to show you was that from that individual homepage, if you've already recently accessed that, that individual's file, you would just simply click on their name. It's going to bring you over to that individual homepage, everything about Penelope. Over to the left, I have modules. In the middle of my page, I have all of her ISP programs. And staff could certainly go right to here, right into her toothbrushing goal and start their documentation right from there. So it's kind of like a one-stop shop of documentation. I don't have to go to the individual tab. I can use the individual homepage and locate all of her goals. Some of them are EVV only, so therefore I have to use the mobile app. Others are available for me to document right here. Teacher staff that they can certainly go ahead and search out to see if they, you know, what documentation they have done so far. So if they do a search, it'll show you the date that data was collected, if it was billable, that begin time and end time duration, the location, and even some of those comments. So that's a quick way of me just double checking before I leave my shift that I've done my documentation for Penelope. And that's over to the left where it says ISP data. I can do today, last week's search. For those managers who are looking to run those quick reports, they could run a quick report of the last 30 days for all of her goals. And it's going to show me that, excuse me, for meal prep. Let's see here. For the last 30 days, so it's going to count, 15 days from August, the last 15 days of August and the first 15 of September. It's going to show me that in August, there was no data collection. However, September the 1st and on, there's a couple of days of documentation. Okay, and there's a couple of days that there's holes in my data. You'll see that for the other goals, no one has been documenting. Oh, wait a minute, here we go. There was one that was done, and that was today that we did, or someone did on a mobile app. Okay. These are all the goals for the last 30 days. This is another one that was documented on, and this is the one that we did today on this webinar. Okay. I can certainly go right on in and click on the initials. Anything in blue is clickable, and I could hop right into that data collection and read what took place right here during that documentation. Okay. So that's one way of running some reports. I'll pause right now for some questions before I show you 2 reports that are helpful when you're doing ISP data. Connie, any questions?
We have no questions yet, Mimi. Thank you.
Good. I hope I'm giving everyone some really good information. If there's something that I left out or something that you truly want to ask or know, this is the time to do so. So from the individual tab, you also have access to what's called ISP Data Report. And I can go right into G's residential where we know Penelope's receiving services. I'm going to click on Penelope and I'm going to say, maybe I just want to view, let's see here. She has activities, she has these. We'll do all of them. And I'm going to click next. I showed you that data collection monthly one, which is basically the collection for the last 30 days. So we took a look at that one. Let's go ahead and take a look at that clinician one. And I'm going to say, starting from September the 1st till today's date, I want to see data that has been collected. Think of the letter C from clinician to be the comments report. This is the one that's going to allow you to view those comments. And again, anything that's in a blue ink is clickable. So if I click on that blue date, it's going to show me that data entry. Okay. Now this is per all the goals that I've selected. So you'll notice that, here we go, September the 10th, it's showing from 9 to 4. Mimi was the service provider, that was 7 hours. And these are the items that were worked on. Now this is her activity report, and it looks like we did language, fine motor, gross motor, parent education. Right? There goes some of those notes. Nothing else was tracked. But again, you could use this as kind of your quarterly report. As far as, the progress towards the outcomes, completed, are they maintaining, they're making progress? Maybe we need more data. Okay, and then this is where you would put your findings, regarding the data that has been entered. You also have a section where you could put in recommendations, right? So future recommendations. And you can save this report, making sure that you give it a name. I'll just say PR's September report. I can come down here and I can save. What's really cool about that is that anything that you save is always reachable. So just by clicking on search report, I can come down to the bottom right, click search again. It's going to show me all of the reports that we have saved in this demo Therap account. So if I want to hop into maybe her monthly report, I can take a look. Look how fantastic this programmatic report graph looks. It showed me based on those acronyms. For gross motor, let's see here, she's at 100% for yes. Current education looks like 100% for refuse, or yep, it's like refuse on that one. Okay, so this was a report that was saved. And then it also gives you a total. For EVV, if anything was tracked, you would see that there. If any goals, anything was documented on. This is just one of the reports. And then again, you have your comments and recommendations. Let's see if I go back. Maybe I'm going to take a look at a different report, another clinician report. There goes some of those recommendations. I'm going to go ahead and hop into the help and support site for Therap just to show you where you can find webinars and maybe even courses. So from the training, click on training courses for ISP programs, click on view all courses, and you can find the ISP program and ISP data self-directed course. It's going to walk you step by step, okay, on ISP programs and data. The other thing I also wanted to mention before we go is making sure that you take a look at the list of roles. And this is really helpful. For those who are wondering, what permissions do I give certain staff members? Okay, this will break down for each of those privileges what it allows them to do. So if I go into maybe ISP program, it's going to say for ISP program submit, it's going to allow that user to do things like save, submit a new ISP program. So it breaks down that definition. Okay, it's called the list of roles. I'm always promoting that user guide just because we do get a lot of chats on Live Help saying someone can't see something. And it's more of, let me guide you on how you get them to see it by giving them the proper privileges. I'm going to pause there. Connie, any questions?
No, Mimi, we're still good. Well, we are at time.
All right, it is 1 o'clock. Thank you so much for all of you spending so much time with us today. I hope this was an informative webinar. Feel free to always attend future webinars or reach out to us through Live Help or feedback if you need any additional assistance. Thank you so much, Connie. Thanks for your help. Be safe, everyone, and take care.
Bye now.
Bye now.